Welcome, everyone, to HHQI's Underserved Population Network. We appreciate you attending today. We're very excited. It's going to be on chronic health issues affecting the Hispanic population. We're going to jump right in with our presentation here after I introduce our speaker. And today we're very fortunate to have Viviana Lozano, and she is a certified hospice specialist at the VNA of New Jersey. Viviana has a Bachelor of Science in Nursing from Bloomfield College and is an active member of the National Society of Leadership and Successful Association, as well as the National Association of Hispanic Nurses. Recently completing a certification as a hospice specialist and currently working as a hospice case manager for the VNA of New Jersey. Viviana is responsible for supporting the organization's mission by striving for excellence in all aspects of her job while focusing on building positive interpersonal relationships with her patients as well as her family. She also collaborates with patients, their families, and other members of the interdisciplinary team to achieve the highest level of quality of care. Viviana's 15 years of healthcare experience include surgical coordinator in a private practice specializing in cardiology, internal medicine, and ophthalmology. She has various experiences, including management positions. She also is actively serving as the chair of public relations and marketing of board members at the National Association of Hispanic Nurses, the Garden State chapter, who has coordinated this session for you today. So with that, I'd like to go ahead and turn the presentation over to Viviana.
Thank you very much, Mr. So my name is Viviana Lozano, and I want to give you a brief biography. I was born in Colombia, and I came to the United States in 1998. Since then, I've been working in the healthcare field, as it was mentioned during my introduction. And I always had interest in the community that we serve, specifically the community, the underserved community, the elderly, and the Hispanic population. I just want to, we can change to the next slide. My goal with this webinar is to show you a clear picture and maybe to share some understanding of how the most serious issues that are affecting the minority population and the underserved, maybe to help you create some consciousness among all those who are serving the community right now, the healthcare providers, and I would hope to present some solutions and share my ideas about how we can help to close the gap in the disparities between the Hispanic population, especially the elderly, and all of these underserved population that is falling between the cracks. We can jump to the definition of target population slide. So I just want to give you a definition about what's considered, according to the federal agencies, as Hispanic or Latino person. The Hispanic or Latino population has no one group. They're subdivided, and they're considered Mexican, Cuban, Puerto Rican, Central and South American, and then Spanish, other Spanish culture or origin, regardless to the race. Right now, the Hispanic population is the largest and fastest growing minority in the United States. According to the last census in 2014, we had a 43% growth compared to the previous census in 2010. And this is according to the Census Bureau's the government site. I just want to give you an idea of, I'm sure that many of you are aware, but it's just, and we see it every day since we work in this community, but this population is growing, and along with them, all the many issues that affect them. So I just hope that I can, again, shed some light and give you some more understanding. I just want to break down also some percentages of what is the percentage of Mexican population is a 64%. The Puerto Rican population is a 9.4%, and then the Salvadorian 3.8%. All the populations are between 13.7% of the population. But during the last census, the Hispanic population accounted for 16-point-something% of the United States population, and they're expecting by 2060 this is going to double in numbers to about a 36%. Unfortunately, out of all this population that we deal with in the community right now, many of them are not, they don't go to school, they don't go to college, and many of them don't finish high school. Most of them are part of their impoverished population. And as I said in my next slide, where it says demographics, they really constitute, minimum only a 6.8% of the students in colleges. I will tie up this later in the presentation as to how it affects the reason for all the problems and the issues that are affecting the population and how it's related to the health. So I want to touch on the leading chronic diseases among the underserved Hispanics. So I was amazed as I was doing the reading and the research, and even though I'm in the community for so many years, we always have this misconception in general that the Hispanic population, and as of the general, the rest of the population, that the leading reasons for diseases and death is cardiac disease. As I was doing the research, I learned that the population, the Hispanic population especially, is affected by cancer. That's the number one. Then heart disease, stroke, and diabetes. They're the four leading causes of problems or chronic diseases in the Hispanic population. And as I was looking farther into it, I realized that prostate and breast cancer are the leading two causes of dying among women and men of Hispanic descent. According to the American Cancer Association, there's many reasons which I agree with: socioeconomical barriers, cultural, poor resources. They say 26% of the Hispanic population, the Hispanic women under 50 years old are diagnosed with cancer, and it's the number one reason for death in this population. Many of them because they have poor screening, they find the diseases at a later time when it's hard to treat, because they have difficult access to care, difficulty with access to care, and they still don't have insurance. In the men with the prostate cancer, right now the survival rate is 81%. But when you look at in general the population, but when you look at the Hispanic population, the patients in the Hispanic community have a 76.5% chances of surviving prostate cancer. And the reason is because most of them, 31%, detect the cancers at a distant stage when it's hard to cure, when it's hard to treat. Then we go to heart disease. So heart disease is in general in America number one killer. For Hispanic, it's number 2. And once again, we see the same thing with this community is many difficulty according to language and linguistic barriers, lack of health insurance, delays in care, and usually the Hispanic population requires that one-on-one follow-up because many of them tend to drop their care after they start feeling a little bit better. So those are some of the things that as healthcare providers, as community healthcare providers, we need to assure that we look into and try to enforce and promote. Then we have, on our next slide, we have a stroke and diabetes. So stroke is directly correlated to hypertension, heart disease, obesity, which are predominant issues in the Hispanic population. I'm sure many of you who take care directly of the community and the patients in the community have seen this. And this is not, it's not a new problem. It's also a general population problem, but it increases the size and difficulty to treat with the Hispanic patients because compared to the non-Hispanic patients, 30% of the population of the adult Hispanics suffer from hypertension. That's 3 out of each 10 of Hispanic adults that is suffering from hypertension. Therefore, they have signs and symptoms of stroke at an early age. And again, we have the similar issues. According to the stroke, the website for the Stroke and Heart Association, there's a direct correlation once again with, decrease in proper prevention, screening, lack of insurance, and there's no enough follow-up between the healthcare providers, the community, to try to keep the patients in track so they can take their medication and don't start just when they start feeling better. Also, there's a direct relation with culturally accepted and wanting, for example, diets, such as in Hispanics, we like to eat spicy food, we like to eat a lot of which are high in carbs, mainly because it's what we are raised with, and also because for socioeconomical issues, we try to be in a budget, and it's easier to buy rice and beans than to buy vegetables that will be probably they will last longer time. They'll be more perishable, and might not be able to feed as many people in one house. According to the National Health and Nutrition Survey, there was a report that Mexican Americans and 64% of Mexican Americans, and again, we said that the Mexican Americans are also the highest percentage of population of the Hispanic, the growing Hispanic in the United States, and 64% of them do not exercise, have a sedentary life, and not necessarily all, it's not 100% because of choice, but many of them because they cannot afford to join a gym because they cannot walk. There's not enough safety in their neighborhood to walk the recommended time. because many of them are undocumented and have no insurance and no way to obtain insurance. So really they have to, they attend the emergency room, but they don't do any prevention, they don't go to a prevention clinic, they don't have groups of support, and they don't usually tend not to look for them either because of the lack of linguistic skills and communication skills. Being that culturally, being that they have a different language as their main language. So there's also another study of the American Diabetes Association that found that 16.9% of both men and women of Hispanic descent have diabetes compared to a 10.2% of non-Hispanic whites. So there's a big issue and something that we need to, as community leaders, as community healthcare providers, we need to address, and we need to focus our program to address this. We can go to the next slide. So some of the points of discussions that I have prepared, and I think are the main thing, and I believe we have talked about already, are communication barriers. So many of the Hispanic population speak some English, but the majority is Spanish as the first language and prefer information in their mother language. For comfort issues, for understanding, who doesn't want to be talked to in their language that they were raised with when they're sick? Usually when you're sick, you require extra attention. Things become harder to understand, become harder to assimilate. And the fact that you are being helped by somebody that doesn't speak your language, that doesn't have your same culture, and have minimal or non-understanding of it, it's easier to block every information you get in, and to, for people, especially with Hispanic descent, for them to block the information and really not assimilate it. So there's always an increase in population. According to the census, and I'll give you just a couple numbers so you have an idea of this constant immigration to the United States. I'm sure everybody knows about it. I'm sure there's nothing new. I'm not giving you new information, but I just want you to have an idea in numbers so that you can kind of see the whole picture. So in the 1980s, from 1980 to 1980 to 1989, there were 1 million immigrants that came to the United States as residents or legal immigrants. By 1999, from 1990 to 1999, this doubled to 2.7 million. And from 2011 to 2014, this number has increased by 40%, as I mentioned before. So, and this is not counting all those who come to the United States, and at this point are really not counted by our census, or for whatever reasons that come without legal documentation. So, having constant immigration to the United States, we have to have that under consideration that these are problems that need to be a constant. We need to address them, and not forget that even if you address it with 1 or 2 generations, it's always going to be an ongoing problem. So there has to be a target to specifically those people who are coming in year to year. But we also have another main issue, I think, as a healthcare provider, and that ties with the fact that there's such a small percentage of the Hispanic population that actually attends college. And those who attend college is really a very minimal percentage that actually go to do nursing or to become doctors. although this has grown within the past couple of years, it still doesn't add up to the numbers of Hispanic population. So I was reading that about, I'm going to give you specific numbers. In the state of New Jersey, which is where I practice, 16.9% of the populations are Hispanic. And only 2.3% are physicians. When you look at the numbers, is out of 33,000, 33 or more thousand doctors, only 757 are Hispanic. And the same thing in New York, the state of New York, where it's about 17% of the population are Hispanic or Latino. 2% of this population are nurses or doctors that are Hispanic. So out of the 88,000 doctors in New York, only the 2%, only about 1,800 doctors are Hispanic. Another very difficult issue that I have encountered along the years helping the community, the Hispanic community, is the low level of healthcare literacy among the Hispanic population. Most Hispanic population, and at one point included, we tend to just listen to what the healthcare professional is telling us and make that the rule of thumb. We don't tend to figure out on our own, to learn more about the disease, to investigate, to research. We really just, we are based on today's our treatment and everything and all about it. I mean, we base our treatment solely on the information that we get from healthcare providers, from the clinic, or from the nurse or the doctor. And this is why I see that, especially this, the fact that we have such a small percentage of Hispanic healthcare workers and such small percentage of people that can relate culturally and linguistically. It's such a big problem, because when this population is relying entirely on what you're telling them, most of the time, if they don't understand or they're misguided in any way, probably the outcomes are going to be very poor. The health outcomes are going to be very poor. And again, we have low income and lack of resources, and not enough support from those community as well as healthcare providers. I know there's a lot of, there is some support. There's a lot of organizations that try to help. They try to help the community and have, many specific, especially new organizations that are trying to shed some light and education and to progress towards that goal of helping the underserved community. But it's still a lot more work to do. And one of the main things is that we don't have enough, the information, I don't think is disseminated enough. I think we need maybe more marketing, more letting, working together with the newspapers, working together with the Hispanic, maybe television channels, and all the people that can actually advertise. I know in some of the, this is my personal observation, when I drive around New Jersey and I see all these signs in the highways or in many other places, I see all the signs are usually in English. I don't see any signs that with information about community education or community health, or even when it says this is this hospital, this healthcare center is basically in a Hispanic-based community, and the information and the advertisement is usually done through American, only English-speaking companies, and even the signs are usually only in English. And I think that brings decreases the opportunity for those who are not linguistically capable of understanding it to even seek for that help, even though it's there, because it's not promoted enough. So I think also we have talked about the linguistics, and I think again it's one of the main things is it has been for many years, and I think will continue to be as long as we don't build programs that will educate healthcare professionals, the community leaders in appropriate linguistic medical skills. It's funny how many times I had encountered during my years of community, in the community, episodes and scenarios where the Hispanic patient is completely misunderstood. I can give you like one or two things that I encountered. A patient at one point had some type of brain injury and had neurogenic bladder, couldn't urinate. I had information that he was touching himself, that he had behavioral issues. When I finally got to speak to his patient, all he wanted was to urinate, and because of the neurogenic bladder, he couldn't do it himself. We had to catheterize him, and but this if the person that was helping him before me could have more understanding of what was going on with him and more understanding linguistically, and being able to communicate better with him, this patient suffering would have ended earlier, and thankfully nothing major happened, but it could have. So something as simple as maybe improving and adding more linguistic tests, linguistic courses within high schools, college, but basically more, not only in general to learn how to speak Spanish, just to say hi, hello, how are you, do you have pain, but a more detailed and more specific understanding of the healthcare. We have to try to incorporate the community. We have to, once again, there's a lot of lack of culture competencies. A lot of people they don't have that understanding that the Hispanic community really needs everybody that you let in your life, whether it is a friend but also a healthcare provider. You want them to become, you trust them, but you also want them to become almost like family. And that to continue that one-on-one. If the Hispanic community, the Hispanic patient doesn't have that almost one-on-one, I'm your friend, I'm here to help you, that really bedside manner, they don't trust you and they cannot follow your recommendations. You have to understand that once you're starting to give recommendations to benefit their life, the way they're eating, how they eat, what they exercise, you have to address it from the cultural point of view. You have to be sensitive of what has been served to them for generations, what is the foods that they're familiar with, what are the activities that they're familiar with. You cannot send somebody to play tennis when they have never seen a tennis racket in their life. You cannot tell them. You have to really think of how you're going to incorporate this within the teaching curriculum, within the community outreach programs, to really focus on the way that you can teach these people to change their lifestyle, to change, to improve, to learn, to ask, to trust the providers but you have to do it in a way where you incorporate their culture and their needs. Another thing that I have encountered throughout the years is that Hispanic community are very family oriented, and with their family that kind of goes after the physician tells you to do something. If family, there's a lack of family support. If your family at home is not, everybody, if you tell a Hispanic patient, you should stop smoking, it's not good, you're going to increase your blood pressure, it's going to, going to put you closer to having a stroke, it's going to make you have this and this and this and that. But if you don't involve the family, then the patient's going to go back to a home where all the people are smoking, where all the people are eating fatty food, where all the people are doing the things they shouldn't be doing, and it's going to fall through the cracks. It's going to continue the vicious circle, and it's not going to we're not going to be able to make changes. So we really have to incorporate this family. We have to incorporate the family in every community programs that we do, making not just patient-centered, but family-centered, family-oriented. And I think we will have improving outcomes if that's the case, if we do that. So my next slide is changes to improve healthcare barriers. And I think it's pretty much a conclusion or a touch-up on what I've been talking about. Provide more education and training, especially in linguistics, to all healthcare providers, so they can continue to serve the underserved population in a more effective manner. I think developing training throughout education for healthcare providers, especially focusing on the underserved communities. And this goes both ways. Help maybe introducing community health, community-oriented teaching to the high school and the youth of this underserved population, but also developing this education and this training with the healthcare providers that don't necessarily have to be of Hispanic descent. We need to definitely continue and initiate more community progress, focusing on education of the underserved population and their needs, especially for disease prevention. I think if there was more disease prevention and more screening, we will have, we will definitely, have less problems with, for example, cancer being the #1 killer for Hispanic population. I think a lot of what is in my next slide, which is changes to improve the health care. I've been once again talking about it throughout the presentation. I think we need to increase the educational material to the public. We need to focus on their needs and their literacy level. We need to incorporate help links and popular magazines and Hispanic channels, and be more efficient and proficient, trying to get the word out to the community about all the services that we have, and all the future services that you're planning to develop. I think we need to create more programs to support families, especially when the individuals are sick, so they can also provide support to their own family members. And we need to continue to support and advocate for those that are looking to improve the Hispanic community. For all of you who are listening right now, who are interested in understanding what's the Hispanic community, what are their needs, what is the, how can we develop programs, how we can develop legislation, how can we develop information and help for all these people that are falling between the cracks and need extra help. I think that this is the end of my presentation. I hope that this information was valuable to you. I hope it helped you understand a little bit more of the Hispanic population. And once again, if you have any questions, I am adding my references here, and you can always look into our website at gardenstateman.org for more information related to this. Thank you very much.
Wonderful, Viviana. I'm going to let you get your breath for a second, and we'll ask anyone if they have questions to go ahead and start putting them into chat. But even before that, I want to throw out a couple chat questions. So I'd like to hear from all of you. Even if it doesn't matter what kind of organization you work for, but I wonder, do any of your organizations that you work for now or recently in the past have offered Spanish classes to those who do not speak Spanish language? So let's kind of see what we get from some of the participants. Does anybody offer Spanish language classes within your organization? Let that chat come through. And if you have any Q&As, questions, you can put those into the Q&A or into the chat to let us know too. Trying to see if we got anybody that's offering that type of class. So far, I'm not seeing anything. I know where I had worked previously, we talked about it, and we just never got any further because we lacked, as Viviana has shown us, lacked having anyone that was fluent in Spanish to be able to teach the class. But we had looked into some online classes. Okay, well, I'm not seeing anything there. So I'm going to throw out one more chat question to see, is there anything that you're doing as a program or some type of something specific to meet the needs of your Hispanic population at your organization? And you can send that into chat too. We'd love to hear from you and see what you might be doing that we could share with each other. In the meantime, while those are coming in, those are two chat questions for you. I'm going to start off some Q&As with Viviana. One of these interesting things, you have many interesting pieces that you talked about, but when you talked about health literacy and signage, it made me really think about navigating the healthcare system. And we know with the underserved population in general, that is so difficult if they have literacy issues in reading, let alone another language, but being overwhelmed in a healthcare system and trying to find a doctor's office for the first time. Any tips or any thoughts more related to that in trying to understand better in preparing our patients to going someplace new that for the first time in a healthcare setting?
I think simplicity. I feel that, and it happened to me with my parents or my grandparents, when they try to apply for anything, for example, insurance. Many of them don't even want to do it just because they don't know how to, as you say, navigate through all the questions. Once they go to 2 or 3 pages of information, requisitions, it's hard for them. Now, we can also maybe try to start community centers that will help them specifically with that. I know when you call, for example, with the Obama administration, with the Obamacare, you can get somebody in Spanish, but all this is time, requires time, too much time in many cases. It requires many, many tries. They won't call the person back for, sometimes there's so many on hold because of the need of translation or specifications of the process that it takes. You know, I heard from people in the community, it will take, sometimes they call them back. They leave them in a waiting list. So in the meantime, all these people either give up and don't want to follow up with your medical, if you have to go to a physician and they send you a form and you can't get a hold of somebody in your family that can speak English and can translate for you, most likely you just not go to the specialist. So most likely you just give up and don't do it, or go back to the primary care physician with some changes on sending you back to the specialist who is not going to, and then it's going to be a vicious circle. So,
okay. I think that's very valuable, and we're going to talk in a couple minutes when we move on to some of the HHQI slides about resources and Spanish translations and things like that. But keeping things simple and to the minimum, and keeping, maybe we can do a little more legwork in prepping for the calls and things like the visits and stuff to help the patient too. Just never really thought about that till you brought that point up. The other two questions I have are related to family and family culture. You brought up about, in a lot of cases, families are families. It doesn't really matter their culture, but I have done a lot of work with doing some mission work in Mexico as well as doing mission work in New York City on a fairly regular basis. And I have found, in my observation, such a very difference in the value of family. Family is, to me, more valued in the Hispanic population, and that they tend to be more active and involved with each other than sometimes we see, especially in an inner city type area. So with culture, family dynamics, and does caregivers help make decisions in typical Hispanic populations in general? And then after that, I'd really like to know a little more too on how, because of your experience as a hospice nurse, what are the feelings of hospice care and palliative care from a Hispanic community?
Interesting. That's very interesting. I actually very often have to go and do evaluations and explain. First of all, most patients, when they are referred to us for hospice, they are not even sure. I recently had a case where the doctor called me and said, I need this patient in hospice. And I explained it to the family. I called back and the daughter spoke fairly well English. She said, they understand, I just need you to go do the evaluation and start this patient in hospice care. She had a multitude of medical problems and whatever else. And she's really there. She's at the time when she needs to be admitted to hospice. I called the daughter. I explained the hospice philosophy. I explained it, and then she said, "No, this is not what I need for my mom. I just needed extra care. I do not need. My mom still has a lot of life in her." So culturally, the Hispanic population, I think, doesn't think of hospice specifically, so they really close to dying. And even then, they want to be with their family. I agree with you. I mean, the family ties are enormous, and they're very, they don't want hospice services in most cases for the family members. They don't feel that that's appropriate in most cases. So it's very tough. They have a lot of misunderstanding about the hospice benefits all the time, and in many cases it's because the physicians, when they address the hospice, they say they don't specifically say because of this. It's just because you can't. I think your family member has a terminal illness. They're not clear enough. They don't understand it. They don't understand that they have some terminal illness and that they don't need to be 1 or 2 days before dying to be in hospice services.
Yeah, and I think it goes right back to your point of what still needs to be done in the community and more awareness about healthcare prevention as well as the full continuum of care. I totally agree with you too. And I'm going to go ahead and hit some of the additional slides, and we'll come back for questions. If there are more questions, please send them in. We did get some feedback. Many of you do not offer lessons or Spanish lessons, but some make sure that you have consents that are in different languages and have some handouts and tools that are available, as well as being able to offer interpreters or interpreter services. So that's kind of what feedback we got. Some of our HHQI resources, we have a new best practice intervention package that's coming out May 1st. So that is next week, believe it or not, I think, right? I can't remember what week this is. It's a cardiovascular health at-risk populations. It's a focused package. It is written for clinicians as well as leadership. It's going to talk about race and ethnicity. It's going to include underserved regions, looking at women's health and gender health, looking at some of those risk factors for those populations, and also a little bit more with health literacy. We have other best practice packages that some of our key patient tools are translated in Spanish and are available, and I'm going to show you on a slide in a minute how to find them. And actually, I guess I can move that to that slide now. The easiest way is you can look under the different topics, and if there's a Spanish translation, it will be as a sublink under it, and so you'll be able to see the English version if you'd like, and then the Spanish version. All of our tools and resources can be used. There's not a copyright with it unless it's specifically, we only have like 2 things that have specific copyright. You can't change the language. Otherwise, you can edit and make it more appropriate for your populations. You can put your logo on it, your et cetera. You can really make, fine tune it to what is going to be meaningful for your patients in your community that are working with you. But the easiest way I found is if you just either click on HHQI News, which is, or you can just do a search for Spanish, and you'll see different things that come up, such as, and I gave you an example on this slide how to find one of those sub-bullets. So you can see 6 tips to cut sodium, and in a sub-bullet, it is the Spanish title of that. So you can click on and download that and use that if you'd like. There are more coming every month. We post at least 4 or 5 new ones each month, and we'll continue to try to do that for you. The reason we selected Spanish initially, and I think some of the statistics that Viviana talked to early in the presentation fall right into to that. We use the U.S. Census Bureau findings for those people living in households that do not speak English as the first language. It is 62% are Spanish when you look at all the other languages. And then it drops down to 4.8 for Chinese is the very next language. So that is when English is not spoken as the first, as the primary language. So we have, and it's going to continue to grow, as we heard from Viviana with the statistics. So we know we need more resources for that to be able to provide to the patient. HHQI University is what we have. We offer free continuing education for nursing. Currently, here's the titles of the courses that we have. You can just go on under Education tab on our site, and then there'll be a connection to the university site, and you can see the different topics. Do look for our newest one that will be coming out with cardiovascular health for that underserved or at-risk populations, and it'll be worth 2.15 nursing hours because it's going to include it will include that new best practice intervention package to read and a clinician video, an overview of racial and ethnic issues and barriers with patients related to cardiovascular health. And you can always connect with us with HHQI. We're on Facebook, Twitter. Now we're on Pinterest just this past month. So do check us out as well as LinkedIn. We do have every other week. We have HHQI blogs. Do look. Last week's was talking a little more on the proposed conditions of participation. do look for next Friday. They're usually posted on Friday. You can sign up and the feed will come right into your email. Next Friday is a nice message for thanking nurses for Nurses Week, so do take a look at that. And we also have live chats once a month, and they're usually the third Thursday of the month, I believe. Or Misty, is it the third or the second? Let her get a chance to come off.
That's the second Thursday of each month.
Thank you. I guess it's the cardiovascular land cuff that is the third.
Correct.
Okay. We do, before we, close out and everything, we'll take any other questions that you might have for Viviana. And I do want to remind you as you exit today, there is an evaluation. We do look at that. We ask for feedback. What are other topics? Our next underserved population call will be July 22nd. Well in advance, you'll see lots of notifications. We're going to talk about housing, and we're going to talk about some other needs of the underserved population at that point. But I'm not seeing anything else coming in. Misty, are you seeing anything as well?
I don't have anything on my side.
Thanks, Misty. Well, we would like to thank you from HHQI, Viviana, for presenting today. You gave us a lot of valuable information for caring for patients right now. I think you also gave us a directive and an idea of how we need to be more advocates in sharing healthcare awareness for the Hispanic population, and to think about all patients of any ethnic or cultural at-risk population and being able to help guide them through health care and prevention and reduce the mortality issues and being able to get the care that they need. So, and we'd also like to thank everyone that has attended today. We appreciate your time and hope you found this meaningful. The handouts are posted on the website under the Up tab.
Thank you. Thank you for the opportunity.